Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome to this episode of Let's Clear the Air, all things allergy, asthma, and immunology. This is Marcella Feathers, and I have the pleasure of being with one of our newest nurse practitioners, Sharon Lever. Sharon, welcome to the podcast.
Thank you very much.
We are excited to have you today because I heard through the grapevine that you actually heard the podcast, and that's part of the reason why you were interested in coming to our practice, or interested in our practice.
Mm-hmm. That is a true story. Probably about 2 years ago, my husband and I decided to escape the climate, the cold weather and everything of the Northeast.
Where were you living?
Massachusetts, practicing in New Hampshire, coastal New Hampshire. So, we'd see a lot of weather. So we decided to move to warmer climates. And so we decided on East Tennessee. So I love to listen to podcasts, medical podcasts, things like that. So I came across this podcast and really loved it and would routinely listen.
Oh, nice.
So, when we made the decision to move down, I said, you know what, let me just cast my net a little bit. So I sent some information about me, our plans to relocate to the practice. And I said, if you could just keep me on your radar, if you're ever looking for, a new NP. And this was probably just about a year ago that I did that. And then a couple months later, I actually heard from one of the NPs from the practice. And the rest, as we say, is history.
Excellent.
And, I'm very, very happy to be a part of the practice.
Well, we are happy to have you. And you've definitely moved to warmer climate.
I'm very much looking forward to the warmer weather. Mm-hmm.
What made you choose Tennessee?
So we have friends down here, and we've been kind of back and forth vacationing for the past couple of years, and we just love the area. So we decided to settle here in East Tennessee.
Well, good. You definitely have a lot of allergies to choose to help folks with here in the area.
Yes, so that's good for business.
All right, so let's hear a little bit about how you got into allergies as a specialty. Can you tell us just a bit about where you grew up, what school you went to, why you got interested in allergy?
So I'm originally from Methuen, Massachusetts, which is about 20 miles north of Boston. So, born and raised in the Northeast. I went to school. My first undergrad degree was in business management, so I did that for a little while and quickly found that that was not the path that I wanted to pursue. So I went back to school and I decided on respiratory therapy, and that was over 20 years ago. So I was a respiratory therapist for many, many, many years. Where I treated patients of all ages in the hospital setting, critical care, general pulmonary, and I loved that job. But after a while, I learned that, I needed to kind of expand my skill set, and really kind of looked at career paths. And I decided to go back to nursing school. So I did that. I got my undergrad from Massachusetts College of Pharmacy and Health Sciences. And I always knew that I wanted to pursue becoming a nurse practitioner. That was the ultimate goal. So my graduate degree was from Revere University, which is in New Hampshire. So, trained everything in New Hampshire. And I really knew that I wanted to do something maybe pulmonary, and that's how I first started off in the doing NP work, was in a pulmonary practice in the hospital that I had worked in for 17 years. So it was an easy transition really to do that. So within the pulmonary practice, it was general pulmonary, but it was a hospital setting, so I saw inpatient and clinic patients. And then COVID hit. So that kind of changed the landscape for a lot of everything, especially within the hospital setting. So, I would see patients in the ICU, the emergency room, and it was an experience, let's just put it that way, as we all know. So after that passed, I decided that I needed to have a change of environment, really, and pursued, outpatient clinic. And then the opportunity came up where there was a position in New Hampshire for an allergy pulmonary nurse practitioner, which, I joined that practice very small. It was myself and one physician. So I learned a lot and, thus started my love for allergy immunology. I love pulmonary, but, immunology, allergy is so interesting. And I've just become such, so fascinated with the field, really. And, as I said, we relocated. So, in looking for another position, it was always, in my mind to pursue or continue with allergy. So, yeah, and that's how I got into allergy.
Nice.
Mm-hmm.
Nice. Yeah, I imagine you saw a lot of difficult cases.
Mm-hmm. Yeah, yeah.
And so now that you're here in Tennessee and working with us, I'm sure that your insight and your experience into pulmonology gives you a lot of expertise when it comes to asthma patients.
Yes, I love asthma. That sounds crazy, but I like taking care of patients with asthma. Let's put it that way. I'm a certified asthma educator.
Oh.
So as far as, the education part of it, I love being involved in that aspect. And I really do think that helps me help patients take care of their condition a little bit better.
Mm-hmm.
Because I think when you give patients the opportunity to really manage their own disease and give them the education and the knowledge to do that, their outcomes are far better.
Because that's one of the main issues with an asthma diagnosis is the management of it.
Exactly.
Correct?
Right.
And,
right.
I know that it's important to work with the patient to develop a plan.
Absolutely. And with all the new medications that are out now for asthmatics, it's just incredible. And it's, when I first started in the respiratory field, I mean, there were inhalers and things like that, but very limited as far as what we could treat for asthma. And now, we have biologics and so many different things that are really, really making a difference in our patients with asthma. It's fantastic.
Nice. You see patients of all ages?
I do. So
Excellent.
that's new for me. In my prior practice, we saw patients that were 6 and over, but here, as we know, we treat patients of all ages.
Mm.
So, I'm getting into the groove with seeing the littles, which I really enjoy. I have to be honest with you. So, I'm looking forward to seeing more younger patients.
Now, spring is a tricky time for not just allergies, asthma as well.
Absolutely. So what I've noticed right off the bat is how everything is blooming already here. So, tree pollen counts are high and, thus the allergies. So it's a little bit different. I mean, we have obviously different allergies up north, things that, I need to kind of get used to down here. But, we had definite allergy seasons up north, where here it seems like it's just a little bit of a continuation, like it's year round. I mean, no one gets a break, right? Which, is great for us. And, we can help and treat these patients.
Right. We offer something to help with that relief
Right.
from year-round suffering.
Right.
So tell us a little bit about what you do when you're not in the office.
Mm-hmm. So I am a competitive trap shooter. I know I get that look from a lot of people that I tell that to, right?
I opened
right?
my eyes kind of wide. I'm impressed.
So basically, trap shooting is, using a 12 gauge shotgun, and it's like target, basically. And you try to what we call kill, and we don't use live birds, but we do call them birds, and they're little clay targets that we try to hit. And I absolutely love and enjoy doing that. It's a good stress relief. It's
Sure.
fantastic. So I'm hoping that I'll be able to do a lot more of that for longer in this area. I used to shoot in the cold, absolutely. So it'll be a little bit nicer here, but I'm actually looking forward to getting back into that.
Nice. Now, excuse my ignorance. That's different than skeet shooting, yes?
It is, yeah. It's a little bit different where trap is more... you're in a position, there's 5 positions, and then you move to each position.
Oh.
Skeet, generally, the bird will cross, and it's a little bit different. Honestly, I think skeet's a little bit more difficult than trap, but But I've done skeet before, and it is pretty hard. But I love doing the trap.
How did you get started?
So my husband is a retired police officer, so he was the one that actually got me into doing that. And from day one, I was hooked. I was hooked.
Do you do it together?
We do. We
do.
do.
You get competitive?
We do. We do. Yes. So sometimes I can beat him, and I'll rub it in a little bit. But he's an excellent shot as well. So
I'm sure. I'm sure. And what else do you like to do?
So I have 2 adult boys. One that lives in Florida. He works at Cape Canaveral, so I try to go down as much as I can to see him. And then my oldest lives up here. He moved down here with us, which I was very glad about. But we like to, do all the touristy things so far. Going out. We love the NASCAR. So we love that. And honestly, this is like the perfect area.
It is.
To hit all of the major raceways. So really looking forward. I've been to Bristol already.
Bristol baby.
Bristol baby. Yes, absolutely. So we're really looking forward to kind of going around and seeing all the races around here, within driving distance, which is fabulous.
Yes. Just look out because, 81 and 40 can become their own kind of racetracks.
Absolutely. I've definitely noticed that in my short time here. So yes.
Why don't you tell us what locations for now that you'll be traveling to?
Yes, so for right now, I'll be seeing patients in our South Knox office, our Farragut office, and Weisgarber, I believe, one day of the week.
Excellent. Okay. So if you are listening to this podcast and are interested in seeing our Nurse Practitioner Lever, please give us a call and schedule an appointment. Or if you just want to talk about NASCAR and trap shooting, I'm sure she'd be game for that too.
Absolutely.
But chances are you probably have an allergy or asthma situation that you need help with anyway.
And I can help you with that too.
Yes, we'd love to see you. Thank you again so much.
Thank you very much.
And that's it for this episode of Let's Clear the Air.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.